Hello, my name is Ashley Hornberg, and I'm going to present to you my research from over the semester. I'm a nurse who works in the multi-organ transplant unit in London, Ontario, and I've worked there for 5 years. I help to take care of post-operative organ transplant recipients, but also those who need to be readmitted after transplant to be treated for organ rejection. Rejection is more common than you think, and although it can be treated, it often leads to the loss of the organ. The risk of rejection can be greatly reduced if patients take their medication on time at the same time every day and don't miss a dose. The PICO question that I developed to answer this question over this semester was regarding an intervention to help patients be more adherent to their medication. The question was, for post-operative organ transplant recipients, do technology-based medication adherence programs affect rates of medication non-adherence post-hospital discharge versus routine care with no follow-up? Using this question to create a search strategy through PubMed, I was able to find 4 randomized controlled trials from the last 5 years that researched the effectiveness of smart device apps in helping patients to be more adherent to their medications. Overall, the research stated that medication adherence was higher for those using the app on their device than for the control group. The apps that were successful allowed patients to check off when they had taken their medication. They showed the patient feedback on their progress over the month and actually had interaction with the transplant pharmacist from the hospital and on an ongoing basis to provide motivation, education, and feedback on how the patient was doing with regards to adherence. I used the social cognitive theory developed by Bandura in 1996 to guide my intervention. This theory discusses how observational learning, reinforcement, self-control, self-efficacy, goal setting, and self-monitoring interact to influence health behavior change. Therefore, for my intervention, patients were to download the app before a transplant to get used to it, and were able to set a goal for their adherence and track their progress in the app. Nurses were trained as champions in the hospital to act as supports and mentors for the patients and for the nurses, encouraging them to use the app and answering any of their questions. Patients were able to build self-efficacy when they could see that they could take on this new habit effectively. And this will continue with the support encouragement of the transplant pharmacist through communication on the app once the patient went home. Barriers, of course, to this intervention were staff uptake of the intervention, which were encouraged through the use of the nurse champions in the hospital to act as expert supports for the nurses. Cost was another restraint, and my intervention included the involvement of a stakeholder group as well as an application for a grant to provide those patients who do not have a smart device with a smart device for when they go home. Long-term engagement with the app was the biggest barrier to increased adherence noted in 3 out of the 4 randomized controlled trials. One study did actually study app use over a whole year and found that consistent motivational feedback by the pharmacist assisted in keeping patients engaged. So this was definitely something that I included in my intervention. This was my research for over the term. If you have any questions, please do not hesitate to reach out to me. Thank you very much.